Dr. Mehmet Oz has countered President Trump's recent claims that the measles, mumps, and rubella vaccine could be lethal. Now, here's what the head of the Centers for Medicare and Medicaid Services said on Face the Nation Sunday.
The president wants Americans, and he said this many times, to get vaccinated as their doctors recommend, as long as they have a choice in the matter. The MMR vaccine is not a lethal vaccine, and it is offered in other countries, the measles in particular, separately, like in Japan.
So earlier this month, the president signed an executive order calling for fewer childhood vaccinations and more vaccine flexibility and research. The order also suggested the MMR vaccine be given as 3 separate shots. Now, the Centers for Disease Control and Prevention currently recommends all Americans, including children, get 2 doses of either the MMR or MMRV shots. So let's talk about it. CBS News medical correspondent Dr. Céline Gounder is here to fact-check some of these claims. She's also editor-at-large for public health at KFF Health News. Good to have you with us. So Dr. Oz says that parents should be able to get the MMR vaccine as 3 separate shots instead of 2, can they?
Well, since 2008, that has not been available. Merck stopped producing the separate vaccines in 2008 for the U.S. market. And they have said that if they wanted to reboot that, it would probably take about 10 years to do so. It's not something you can just turn on and off. There are multiple regulatory steps and manufacturing steps in the process. And splitting the vaccine into 3 separate components actually increases the number of injections you currently need from 2 to 6. So it's really counter to what President Trump was arguing for. In terms of the Japanese experience, so in 1993, they split up from measles and rubella and then mumps, so 2 vaccines, and they saw their mumps vaccination rates drop dramatically as a result, so down to 30–40%. They saw big epidemics of mumps, and one of the complications of mumps is hearing loss. Hundreds of kids ended up deaf as a result. And in fact, in May, the Japanese approved a new MMR vaccine, having learned from that experience.
It informed a change. So Dr. Oz also told our Margaret Brennan on Face the Nation that parents should have the option to postpone the newborn hepatitis B shot. What are your thoughts on that?
We've done the experiment in the United States.
Okay.
We actually had that policy in the past, and infants, newborns were getting infected with hepatitis B. Over time, we tightened up or became more aggressive with our vaccination policy, and that's how you ended up with the newborn recommendation, is we kept on missing babies. And the problem is when you are exposed as a newborn, that is the highest risk period to not just be infected with hepatitis B, but for that to become a lifelong infection. So why wouldn't you want to vaccinate in the very period you actually have the greatest protective impact?
So we're also talking about new federal data. It shows that drug prices are down more than 3% from a year ago. That's the sharpest annual drop since 1963. Dr. Oz attributed this to President Trump and his government drug pricing website. We've been talking about this, Trump RX. Is that true? And is it actually saving Americans money at a time when money is pretty thin for a lot of people? Yeah,
healthcare affordability is at the top of everybody's list right now, right? So Trump RX is basically a coupon aggregator. You don't actually buy medications on Trump RX. My colleagues at KFF checked some 22 different Trump RX drugs against generics. And what they found was 17 of the 28 drugs actually cost less as generics than what you would get with the coupon from Trump RX. So my advice to consumers is check the generic prices first on places like GoodRx or Cost Plus. You may get a way better deal that way.
I'll tell you what, as a parent, whenever I see one of your emails pop up in our CBS News system, I lean forward. I read extra closely. Dr. Céline Gounder, thank you so much. Good to have you with us.